This is Mahavir Penna, Assistant Professor, Department of ELCE. Once again, welcome to the second day of the 5-day AICT Training and Learning Atal Academy sponsored online faculty development program on training for social connectedness and inspiration from 14th to 18th December 2020. In this regard, I am so thankful to AICT Management, Sri Venkateshwara College of Engineering, and head of the principal and head of the Department of ENCE, SVC, Bangalore. As far as today's program is concerned, I request Sri Pradeep sir, MSW, MPhil, licensed mental health professional, Government of Karnataka, to take up the session. Welcome,
Thank
sir.
you so much. Thank you so much, sir. Thank you so much. Can I start my session?
Yes, sir. Please start the session.
Okay. Are you able to see the screen here? Okay, just a minute. Just a minute. Now, sir, are you able to see my screen?
Oh, 1 second, sir. It is. Yeah, sir. We can see the screen. We can see your screen.
Okay. Can I start my session?
Yeah, please, sir.
Yeah. Okay. Thank you so much again, and I welcome all the participants for the second session on. It's a continuation of the first part, and in the second part of the session, I'm going to cover more of substance use disorders and like how it happens and mainly what is drug and what is addiction. Okay, when you consume certain drugs or substances, what happens? When you stop consuming substances, what happens? And how to overcome it. And this is again a common mental health problems because of a stress, many people start drug consumption, especially if you look at the licit drugs. There are two categories of drugs: licit and illicit drugs. The licit drugs, where we can see tobacco products, smokeless tobacco, and smoke form tobacco. Smokeless tobacco, which contains gutka, kani, hans, mao, etc., and jarda, etc., and smoke tobacco, which consists of bidi, cigarette, and chutta, and hookah, etc. These are all licit drugs. Even in the alcohol also belong to the category of illicit drugs. We can see the different kinds of alcohol and different percentage of alcohols in alcohol beverages such as beer, wine, rum, gin, and whiskey, etc. But illicit drugs, they are like illegal drugs. They will not available in the open market. Example: cannabis, opioid, heroin, cocaine, and MDMA, etc. So here recently we can see that all over India the drug has become a part of day-to-day discussion. Like so much of raids happened by the NCB Narcotic Control Bureau, etc. And so much of discussions on the social medias and even in the electronic medias about the drug and drug addiction. But here we need to see like why and what do you mean by drug and what is addiction. Okay, addiction is a jargon we generally use for many things: addiction, you're addicted to that, you're addicted to this, etc., etc. But when it comes to the drug is a substance. When you consume it, makes changes in the physical and mental state. Okay, changes in the physical and mental state. So drugs, I have told there are two categories: one is illicit and illicit drugs. And what do you mean by addiction? Next one is addiction. Okay, addiction is a chronic relapsing disease characterized by the compulsive drug seeking and by the long lasting chemical changes in a brain. So here we are talking about drug addiction. There is another kind of addiction called as a behavioral addiction, the term which came up recently because after so much of technological advancement happened, especially the mobile phone, social media, when they came up, and this behavioral addiction started to come up. Behavioral addiction means this is not actually a chemical addiction. So this is a kind of addiction that we develop by using something more which is not actually required. Okay, so that is behavioral addiction. And I will tell you what kind of a changes that happens when you addicted to certain things, like mobile phones or social medias or watching porn, etc. Then the drug addiction is a chemical addiction. When you take a chemical intake, when the chemical goes inside a body, that alters your brain function. That is called a chemical addiction. It's called drug addiction. As I mentioned, addiction is a chronic relapsing disease characterized by the compulsive drug seeking and by the long lasting chemical changes in the brain. So in the language of psychiatry, we call it as a dependence. In the language of psychiatry, we call it as a dependence. Dependence means psychologically, physiologically, we depend on the substance. If you wanted to function yourself better, you need to consume the drug. When you consume the drug, you function better. This is a kind of relationship that established between the drug and human function. So this we call it as a dependency. So here, in the drug addiction, you take example. Let me talk about the illicit drugs, alcohol and tobacco. In the beginning, everything will be under our control. When you start, everything will be under our control. In the sense, you start, tobacco, cigarette smoking. When you don't want to do it, you will stop it. You have that capacity, you have that energy, you have that ability also. I don't want, I'll do it. But gradually, like in the beginning, you start one cigarette, probably one or two cigarettes in a week, and then gradually the number increases. Over a period of 6 times, you will go almost daily, 4 to 5 cigarettes per day. For a period of 1 year, you'll almost reach one pack per day. See, this is what the difference that we need to understand. In the same that applies in terms of alcohol consumption, everyone almost starts with a beer. Generally, we see patients here, they starts with a beer. Okay, they just consume it. Okay, and gradually, like occasionally they consume it like once a week or once a 15 days, or whenever they go to the party, whenever they meet the friends, etc., etc. And then gradually the number increases, one will become two, and over a period of time two will become three or four. Okay, then the cost increases. In a market like one beer, if you go for the lowest one beer, it will cost around 130 to 150 rupees. Okay, 150 rupees into 4, it becomes almost 300 rupees. 300 rupees investment is very big investment. Like daily, you cannot invest to 300 rupees. Then there will be a promotion. Okay, promotion, I should not use this term. I'm just to make you all understand, and to just for the fancy purpose, I'm using it. Then there will be a kind of promotion or advancement from the beer to the hot drinks. You will shift, because for a very lesser price, if you just invest 100 rupees, you'll get one a 90 ml or probably 180 ml of alcohol. So that will contain more alcohol compared to the beer. When you consume it, again, what that heaviness, that heaviness or the kick, in a general language, what we call it as a kick, you will get more. Okay, so then 180 ml becomes, over a period of time, 180 ml becomes two quarter, two quarter becomes four quarter. We have seen a patients throughout the day consumed almost 8 quarters. Okay, 8 quarters. So this is what, but we must understand, like, how people will price, how people will perceive this. When a person, he consumes around 2 quarters of alcohol or 3 quarters of alcohol, and he said that he's just around 25, 26 years of age, he says that people say, see, he's the man, very strongest man. He consumes 2 quarters of alcohol, but still not lost the balance. The physical coordination, the physical balance is very nice. He will not make any kind of a mess up. He'll just go to the home, eat food, and sleep. What a strong person he is. But they don't know that he has almost developed the dependency on the alcohol. Okay, this is what the irony that we see. Okay, but what is the dependence that we need to understand? Okay, dependence means, as I mentioned, that even in India, substance use or addiction is not called as illness. Still, people consider this is an habit. This is not wherever you go, wherever you go. They call it as, yes, I have a habit of smoking. Yes, I have a habit of consumption of alcohol. They say that. They will not say that I almost developed the dependency. Okay, so as I mentioned initially, everything will be under our control. But if you understand this, okay, that's fine. If you lost the control over a period of time, alcohol or tobacco will take your brain functions under their control, completely under their control. If you want your brain and body to function, take the tobacco or take other drugs or take the alcohol, then your body will, mind will work perfectly fine. If it doesn't, you don't take, then it doesn't work perfectly as you want it. So this is what the state, because many people will not understand this. Still they consider this is an habit, this is not an illness. But habit turned to be an illness. We must understand that habit turned to be an illness. When the illness happens, yes, this is an illness. For every illness, there is a medication. For every illness, there is a treatment. Then we must seek the treatment. Still, people after developing an illness also will not seek the treatment, will go along with the illness only. Then they say, and this is the state. This is very important to understand that if a person has developed any problem out of alcohol or out of tobacco consumption, If a person is having a kind of a mouth problem, you just go and ask him what caused this problem. He says that definitely tobacco is not the reason for this problem. This is what the denial mode. Denial mode means they will reject whatever you say. They will reject tobacco consumption, alcohol consumption is not a problem for this, is not a problem for the problem which I have, is not a cause for the problem which I have. This is what the statement they frequently make. In the second para, it is a state of becoming a dependent on a substance which is harmful or dangerous for the physical, mental health, and the person, and economic and social well-being. Okay, so especially alcohol consumption, tobacco and alcohol. See now every year there will be a lot of tax imposed on this product. Every year the price is just going up like that, just going up. Okay, but still people purchase, buy it, people consume it, and finally, if the consumption level is increased, if the level of severity is reached, then the person will develop the physical, mental health problems also. So it will hamper the different areas of life as the other common mental health disorder damages. In the same way it damages more. Next, we need to understand, why do people start drug use? Why do people start drug use? Curiosity and peer pressure. Especially if you look at the age 16 plus, 16 plus, a person, the child will complete its the secondary school education and will join the college education. From PU start, the college education starts, and there will be a lot of the privacy, and then the child, adolescent wants to explore and wants to make more experiment. Okay, want to make more experiment. This is what the curiosity and peer pressure. Curiosity is a kind of it is a kind of a instinct that is a kind of instinct that people want to see what happens when I use it. Okay, what happens when I use it? Usually this is the age more people will develop use of tobacco and alcohol just for the peer acceptance. Okay, a person will be among the friends, and most of the friends, they use the alcohol or the cigarette or any other tobacco products if this particular person wants the peer acceptance. And this is one mode, this is one mode. And wherever they go, whatever the party, and these are major part of the parties. And a myths about the beneficial qualities of tobacco and alcohol and drug. This is what the myths that I have. If the person is depressed, if somebody says that take one little amount of alcohol, you'll be around. And you have some pain, take alcohol, you'll be around. You have some medical problem, you take alcohol, you'll be around. If you have cold and cough something, and there is a particular brand called biscuit brandy, okay, biscuit brandy, take a little amount of biscuit brandy, you will be around. Okay, this is what people say, and this is what the myths that I have. If I take alcohol, my energy increases. If I take alcohol, I'll get more, more energy. I can talk openly, I can talk whatever that I want, my anxiety will subside. The imitation and learning from others, this is one, most of our youths are doing that, imitation and learning from others. Imitation, especially their role models whom they have considered as a role model, and whatever they do, and they will follow it. Especially these medias are now electronic medias, especially movies, they have a very strong impact on the use. That if the favorite actor, if the style in which they light up the cigarette, the style in which they hold the cigarette, the style in which they drink alcohol, so these are all tempt the youths, or tempt the people to follow the same mannerism, to do the same mannerism, they will also follow it. So this is what, at the same time, uh, majorly three, three, what I have explained, 3 points: the curiosity and peer pressure, which is about the beneficial qualities of tobacco and alcohol and drugs. Imitation, learning from others makes people to use it. Along with that, if you look at along with this, there are other certain points which also makes people to use a drug. Number one is the stress. If the stress is very high, to overcome that stress, people use it. If they have any kind of a comorbidities, to overcome that, they will use it. If they have any kind of a domestic violence, relationship disturbances, or sexual abuse, to overcome that, people will use it. So drugs, I have told, it makes them more better. So that is what they use it. So this is what the myth that I have. What happens after drug use? This is what that we need to understand. What happens after drug use? Drug that I have told in the beginning that the drug is a chemical which goes into the body. It makes physical and mental function alter. It makes the It makes the brain function alter. As I mentioned in the first point also, drug that alters the mood and body function that can be habit forming or addictive. Alcohol, I have told, the content, the chemical content which is addictive, especially in the tobacco, the nicotine is the addictive substance. Okay, when you use it, and ultimately the brain develop the dependency, or the brain will get the pleasure. The pleasurable things always brain wants more and more time. So if the brain gets a pleasure, the brain will ask the tobacco or ask the alcohol, I want it again, I want it again, I want it again. People like the way drugs makes them feel. Yes, I am sorrow, I have some problem. If I drink it a little time, a little period, I can be free from those sorrow. I can free from that sadness. But keep it in the mind, it will not relieve your problem. It will not relieve your tensions. It will not relieve your stress. But after that intoxication period, after that heaviness or kick which come down, again the brain wants the alcohol or tobacco again to function in the same manner. Then the pleasure is a powerful source. As I mentioned, that the brain, which likes the way the alcohol or tobacco makes that feel. This is what we call it as a pleasure. Pleasure is a powerful force. So when the brain gets the pleasure, the brain wants it again and again. The next point says the same. The brain wants to use the again and again pleasurable things. Pleasurable things. Suppose it is very simple that if you do some activities, if you get more happy, then you do it more. Okay, brain wants to do it. Okay, you do something, it will give you more happiness. It's a kind of a kick or heaviness. Then you do it more. In the same way, when you drink alcohol, when you smoke a cigarette or chew gutka, it will supply the nicotine. It will supply the nicotine to the brain. The brain will be more active. After sometimes again it wants it. The brain develops the dependency and urge to use it. It controls the human behavior. I have told in the beginning everything will be under our control, but over a period of time, the body and mind control goes to the control of drug. Okay, I have seen people, they stand in front of wine shop, they stand in front of bar, morning 4 o'clock or 5 o'clock. Okay, they develop the physiological withdrawal symptoms, they develop the tremors and all. If they don't consume the alcohol, they cannot they cannot stand even properly. They cannot uh, take something in their hand, because there will be a tremble, there will be a kind of the vibration in the hands. If the vibration has to stop, then they have to consume it. This is what the dependency that they develop. Once the person is addicted, then he uses the drug without thinking and caring about the consequences. Okay. Once the person is almost developed a dependency on the drugs, he just want it. He will not think of the consequences. If I use it, no, I will not think of the consequences. Here, just I wanted to tell one example I have seen. A patient came from some state. He was just around 18 years of old. He was studying in a second PUC. He was having a gang by the time. So what happened? Like, he was just 18 years old. His lifestyle was so lavish. But the family from the middle socioeconomic status, his lifestyle was so lavish, and he was earning around 40,000 rupees of mobile by that time, and almost 2 years back. 40,000 rupees of mobile, and he was having a gang, and he was just feeding them, and he was just giving them whatever they wanted, kind of thing. He used to spend a lot of money. And finally, what happened? He was into the betting. He was into the betting, some kind of games and all. In the BCC and all that will organize into that the betting. And finally, he lost so much of money into the betting and the kind of dependency that this is what I'm talking about. The behavioral addiction. This is not a drug addiction; it's a behavioral addiction. Okay, so develop the dependency. He wants to play the betting. He wants to play the betting. So finally, what happened? There's no money, and he asked the father, he asked the mother. There's no money also, and finally, what happened? He started stealing. He started stealing. He has gone to the relative's home. He's stolen some silver objects, a silver material. Then he went and he pledged it. He took a money and again played, lost it, and finally came to know that, and he has developed a problem called pathological gambling. Finally has developed a problem called pathological gambling. So this is what, like, yes, he wants to do it. He just wants the pleasure. That's it. He just wants to play. He just wants the pleasure, but he did not think of the consequences. His judgment almost gone, and his decision making ability almost gone. And the way he wants to take a decision, he forgot. They want to judge the things, he forgot. He just what he did. He was involved in the criminal activity. Okay, he has stolen the things. He just pledged it. He took a money and played. Okay, this is what, without thinking and caring about the consequences of a drug addiction, or consequences of addiction, or consequences any kind of behavioral also, uh, consequences they do involve in use. Is addiction a brain disease? This is another question that we must understand. Is addiction a brain disease? Yes, definitely it is a brain disease. As I mentioned that drugs are different, but the effects on the brains are common. Drugs are different, but the effects on the brain are common. There is a circuit in the brain. This is what the mechanism. So we see in the brain, there is a mechanism called reward pathways, which releases a chemical, whatever the activity, pleasurable activity you do, which releases a chemical called a dopamine. So which stimulates it will give you a pleasure. The dopamine is responsible for the pleasure. When you take alcohol, when you consume cigarette, these reward pathways will produce the chemical called dopamine. This is what neurotransmitter. This is responsible for the pleasure. This pleasure brain always wants, and over a period of time the brain will develop its own receptors, okay, chemical receptors. To function better they need it. To function better they need the alcohol. To function better they need the uh, you know tobacco products. All addictive substances affect the circuit directly or indirectly. Dependent use, yes, I have told. In the beginning, any substance use will be an habit and over a period of time turn to be an illness. Okay. We must understand when we are saying something as an illness, when we are saying thing, when we are saying some condition or some physical state or some mental state as an illness, there should be a set of symptoms. We cannot just say yes, it is an illness. Okay. There should be a set of standard symptoms. Those standard symptoms person condition has to meet, and duration is also necessary. Duration is very important. Even just observing for 1 or 2 days, we cannot say that he has developed the dependency, he is addicted to it. No, it is wrong. Okay, a proper duration is important. A proper set of symptoms are important. If a person condition is meet that symptoms, then we can say that yes, he is addicted, he has developed dependency. But here I have given certain symptoms. Before that, I'll tell you mainly 6 symptoms. Okay, this is what we call it as a dependence syndrome. Okay, 6 symptoms. Number one is that craving. Craving means it is a very strong, extreme level urge to use substance. Okay, to use it. I wanted to use it now only. This is what. Second one is the physiological withdrawal. If a person is not used the substance, you will develop a physiological withdrawal symptom, certain physical conditions that are unusual. Example, a person hands will start tremors. This is what we call it as a tremors. Hand will start vibrate, cannot talk properly, cannot sleep properly, develop headache, nausea, cannot eat properly, and sexual interest will come down. So these are all the physiological withdrawal symptoms. And then tolerance. Tolerance means I have told in the beginning how drugs habit turned to be an illness. Okay, in the beginning, 1 or 2 cigarettes over a period of time, 4 to 5 over a period of time, 1 pack over a period of time, 2 packs, 1 beer, 2 beers, and then hard drinks, 1 ml, 180 ml, 2 quarters, etc., etc. This is how it increases. This is what we call it as a tolerance. Tolerance means a intake of any tobacco or alcohol which increases to get the same effect a person has got it in the beginning use. Beginning is, this is what we call it as a tolerance. You will just, if you consume 2 quarters of alcohol also, he will be okay. If you consume 2 packs of cigarette also, he'll be okay. This is what the body will develop a capacity that whatever the amount of alcohol it goes, large amount of alcohol it goes, person will develop a tolerance. Yes, he can tolerate that amount. Next, salience. Salience means the person will avoid pleasurable activities that normally he enjoys. Okay, this is what the salience. Person develop. Suppose at 6 o'clock is the time where a person will generally drink. Generally drink. If something comes to the 6 o'clock, a person will avoid. Okay, if you say that I have some work, you just go. Especially a kind of a ceremony, kind of any kind of other activities are fixed at 6 o'clock. I'm telling just an example. A person will avoid to attend that kind of a program because the 6 o'clock is the time when you will consume the alcohol. This is what we call it as salience, will avoid the pleasurable activities. Okay, because the pleasure that he gets by consuming alcohol is much more superior than any other pleasure that he gets out of other activities. Okay, this is, and the next is this harmful use. A person knows that this is harmful. Consuming too much of alcohol, consuming too much of tobacco is harmful, I know, but still I am unable to quit it. Still I'm unable to quit it. He knows that. You will go to the doctor, he say that yes, you have a liver cirrhosis, your liver is enlarging. You know that you have a liver cyst, but doctor says that you have to stop. See, this is what that we need to understand. You go to the oncologist, you go to the cardiologist, you go to any other doctors. If you have these kind of a problems, the doctor say that no, no, man, you have to stop consumption of alcohol, you have to stop, tobacco products and all. But rarely they will say how to stop it. Rarely they will say how to stop it. They do not know how to stop it. Many people, they start use, they develop dependency, they don't know how to overcome that problem. Okay, I will tell how what happens then. The next is that the ample use and very difficulties to avoid or stop the craving. So despite of difficulties, a person like he wants to just use it, he just wants to use it. His personal aspects will get deteriorate, his health is getting deteriorate, his social status is getting deteriorate, the family health or family relationships are getting deteriorate. He knows it, but still he is unable to stop it. He will involve in a criminal behavior. Among these six symptoms, if a person has at least three symptoms for a period of 1 year, for a period of 1 year, we can say that he has developed dependency on a substance. Let me repeat. Among these symptoms, if a person has three symptoms for a period of 1 year, we can say person has developed dependency. Along with this, I have told market tolerance, severe physical and mental health problems, increased dysfunction in daily life. You cannot perform daily life because I have told if the person has developed the tremors I have seen, they cannot even hold a coffee cup. They can't even hold a coffee cup. Okay, this is what the difficulty that they have. Okay, they will try to hide the tremors. They will try to hide they will make a lot of attempts to hide the tremors. Okay, if they consume the alcohol, immediately the tremor stops. Okay, that is what there's some people say, if I don't drink there will be problems, if I drink I'll be all right. Okay, then craving and increased desire to use, usual role obligations not fulfilled, and criminal behavior. I've already told an example. People do involve in the criminal activities, and relationship breakdowns. A lot of family issues will start, and relationship breakdowns, and difficulty stopping in spite of the problems. I know that it has caused me a lot of problems, but still, it's very difficult for me to stop it. Possible withdrawal symptoms. I have told, a lot of withdrawal symptoms, physiological withdrawal symptoms a person will experience. The continued use despite evidence that use is causing harmful to the individuals. Yes, this is causing me a great trouble and damage to my health, but still I cannot stop it. Then the pattern of use, how it starts. This is what we need to understand. The pattern of use, how it starts. There are three levels of use. Number one is experimental use. Generally, youth will do that. Occasional use. No, I will not take regularly. Occasionally, whenever I meet friends in parties and etc. during a festival, and especially we have kind of a ritual that Sundays most of the families they do non-vegetarian food on Sundays, and before eating that, yes, I will take little amount of alcohol. Okay, the mostly to experience the pleasure. And some people say that in the myths, especially youths will having a myth that if you drink a beer and you will put on weight. Some people just they wanted to gain weight, so the beer is one more a kind of idea that they will have. No discomforting on stopping. Okay, in the experimental use, if they stop it also, nothing will happen, they'll be normal. Minimal or no physical or psychological harm. There will not be any kind of a psychological harm in the experimental use because they use it and they stop it. Harmful use, the frequent use, see the changes that happens from the experimental use to the harmful use. The frequent use seeks to re-experience the pleasure. Yes, the kick, the heaviness, they like it, they wanted it again, they use it. Mild discomfort on a stopping, if they stop it, a kind of a discomfort that they experience, the evidence of physical and psychological harm. So this is where we can trace the physical and psychological harm out of using substances. We can understand. Dependence use is almost a severe level of use. A regular use, increasing a quantity and a frequent use, and a craving and withdrawal on stopping, and clear evidences of physical and psychological harm. This is what like the different level of use. But the dependent use is the severe level of use. A person, we can see he has almost developed a severe health problem. He knows that the psychological problems that he has developed, physical problems he has developed. If he stops, again, he will face a lot of withdrawals problems. But here in the dependent use, here in the dependence use, what happens that people need a treatment. People need a treatment because chemical addiction, non-pharmacological therapy doesn't work. First, pharmacological therapy. The second level of therapy is non-pharmacological therapy. Pharmacological therapy is very much important because to address this craving and withdrawal, a medication is important. The medication helps to reduce the craving and withdrawal symptoms. Next, this is very important question. What happens? What happens after drugs? After quit the drug use? This is important questions. What happens after quit the drug use? See, this is the picture that I have put here. It is very simple. Just I just wanted to give a scenario that normally happens. A baby playing with a toy, a very attractive toy. Okay, and the baby like the toy, and most of the time the baby will like it, and the baby will hold the toy. The baby is so happy whenever the toy is with the baby. Okay, when you're playing with that, when the baby is playing with the toy, if you just snatch it out all of a sudden, if you just snatch it out all of a sudden, what baby will do? What baby will do? Generally, all of you know that the baby will cry. They cry a lot, cry more, scream. You can see that baby can roll on the floor. Okay, baby can just break whatever it gets nearby. Okay, if it comes, whatever you just wanted to give, just it will throw somewhere. Baby cry lot. If the baby knows talking, baby may also scold. Okay, but okay, in the beginning, first 5 minutes, huge cry. Okay, a lot of noises it makes, a lot of mess-ups it makes because it just want time. Over a period of 10-15 minutes, 15-20 minutes, the crying level will come down. Okay, the baby can make himself calm. Okay, okay. Then after 1 hour, 1.5 hour, the baby will completely stop crying. Okay, baby will completely stop crying. So this is what we need to understand. When you all of a sudden stop alcohol use or tobacco, your body will react in the same manner. The body will not listen to you. Your mind will not listen to you. They just want drug. They just want drug. They will not listen to you. But especially the withdrawal of tobacco, withdrawal of cigarette, or withdrawal of gutka or jarda, so they are temporary. All these withdrawal symptoms are temporary. We must understand that all these withdrawal symptoms are temporary. It may be there for a period of 1 month, then later it will subside. Later it will subside. Because why I'm telling that, people will stop it, but after they stop it, because of the withdrawal symptoms, immediately they say that while using drugs only I was all right. After I stop, I had lot of problems. I had a lot of problems. Because why? Because they have not aware of, they have no any kind of awareness about what happens after the quit. This is what people fail to quit the drugs. Okay, simply what we say and what elders do at home, that if a child, if a son or any other person at family, so if they use a drug, and we will give them a kind of preach, no, you don't do that, this is not good and all. Okay, we must understand why they are not able to quit it, why they are failing frequently, why the relapse is happening frequently, why they're failing frequently to quit it. What is the reason behind it? The reason behind is that this is withdrawal symptoms or craving. Okay, if the person is able to manage his craving better, if the person is able to manage his withdrawal better, then the chances of quitting increases. The chances of quitting is more, the prognosis is good. This is what is very important. For the tobacco withdrawal, I can see that a person may develop headache, a person cannot concentrate on his work, a person cannot sleep properly, a person cannot heat food properly, a person can get anger. Okay, a person may also feel depressed. So these are all the withdrawals of tobacco. Nausea also sometimes. Especially with regard to the alcohol withdrawal, a person can develop tremors. Okay, if you don't drink alcohol, a person hands will vibrate. He cannot do anything. He cannot concentrate. He cannot sleep. He cannot heat food. He cannot do any work. Okay. Sometimes, if the level of severity is very high, a person may also develop delirium tremens. Delirium tremens is disorientation. Sometimes he may also develop disorientation. A person does not know where he is, whether he is in hospital, at home, or somewhere else, or he does not know what is the day, and he does not know what is the date also. So this is what the problems he may develop. If the severity, if the alcohol consumption level is very high, if the person can develop a complicated withdrawal symptoms, as I mentioned, the delirium tremens. The second one is a seizure. Seizure means fits. Seizure means fits. You may also develop. See, we have seen a people say, in case when they get a fever and all, they stop the alcohol consumption for a period of 3 or 4 days. Okay, when they stop 3 or 4 days, this withdrawal, they develop a seizure and they will come to the hospital. They say that my husband was all right, he was working very fine, but he stopped, he got a fever and developed a seizure. developed the seizure. He had a seizure and all. So then we, yes, then we, when we dig the information, we collected the background information. We understood that yes, he had a severe level of dependency, and because of the withdrawal, then he has developed it. This is one reason I'm telling. For the seizure, there will be other reasons also. There will be kind of organic problem. There will be kind of any kind of the issues at the brain, the seizure that causes. Okay, so this is what I'm telling. We must effectively address or manage withdrawal and craving successfully. We can quit drugs. Okay, this is where for a tobacco use and a non-pharmacological treatment, even there are pharmacological treatment. So non-pharmacological treatment are enough, but for the especially alcohol consumption or any other drugs, pharmacological medicines are the first line of treatment. These are all very very important. First line of treatment. These withdrawal symptoms are temporary. These withdrawal symptoms are temporary, so it will be there for a period of 3 weeks or 4 weeks. First 2 weeks, the withdrawal symptoms are very severe. From the 2 weeks onwards, the withdrawal symptoms, the intensity will come down. For a period of 4 and 5th weeks onwards, the withdrawal symptoms level will decrease more, and the person can able to function better. The person can able to go back to his normal life, and he can lead a better life with the medication. The medications are important, but it is not that easy. But it is not that easy because the brain is like that. The brain is the one organ, it is the most important organ compared to any other organ in the body, which is the neglected organ. Because if you do some physical work, if you're tired, you will give a rest to the body. At the same time, you just compare the same to your brain. Yes, you do a lot of mental activity. Yes, you know that you're tired, you will not give a rest to your brain. You will not listen to it. See, that is what the problem that we have. Okay, what happens after that? This is what thing. Let me come to the management part, and this is a model that we can you can apply. You can apply it in on any other disease. You take a physical illness, you take a mental illness, you take substance use. Apply this model, you will get a very good understanding about the illness. You'll get very good understanding about the illness. Take a pen and paper, write it down. What are all the factors that we need to consider and how to understand the illness? This is very much important. See, in this model, I have told it is a 4P model. Each P stands a different. Each P indicates a different meaning. Here, the first P is called as a predisposing factor. Second P is called as a precipitating factor, and third P is called as a perpetuating factor, and the fourth P is called as protective factor. Let me explain one by one. In the center circle, you can see the illness. We need to see, yes, illness is there. Any problem, I'm telling you again, any problem, any physical illness, any mental illness, among any family members, you must understand. This is what I'm telling. See, if you know this model, you can apply to anybody. Predisposing factor. Predisposing factor here, you must look at the factor which already existing that causes illness. Any factor that causes illness. Predisposing factor, we can see it is a genetic factor. Okay, suppose if some illness are running in your family, it is hereditarily, it will also come to you. Example, diabetes. Example, hypertension. Example, any other cardiovascular problems. Example, any this thing. What is that? Cancers. Any other thing. There are even in the mental illness, there are possibilities. The certain amount of a risk is transmitted to you through the gene. This is what the predisposing factor. This is what you cannot change the predisposing factor. Yes, my parents having a diabetes, even the chances of getting I have more compared because the gene is there. That factor is already transmitted. That is there. You cannot alter it. But you must understand after a certain period of time, there are possibilities. I may also develop it. So I should take certain precautionary measures. Okay. Limit, if it is a diabetes or hypertension, limit the sugar intake, limit the salt intake. Okay. Maintain the proper diet, maintain the proper physical activity so that you can just avoid the risk of getting diabetes or hypertension or any other kind of a mental illness. Second one is precipitating factor. Precipitating factor, the factor which trigger illness, which trigger mental illness, which trigger substance use, which trigger anything. Okay, probably the extreme stress. This is one precipitating. You need to look at the sources of stress. What is the sources of stress? Okay, yes, during a job or at the office, the work pressure is one. If you go to the home, yes, the kind of interpersonal relationship, the relationship between the husband and wife is another one. Financial difficulty is another one. Our health of a parent is another one. Yes, definitely these will be there everywhere. We cannot say that the problems are not there. Yes, problems are there. Okay, but which one is causing your problem? Which one is causing your problem? Prioritize it. Prioritize it. Okay, this is where it is very much important to understand which problem is causing more. Yes, I have no problem. I have lots of money. I have everything, but something is causing you. You take an example. Yes, everything is good. A son or daughter may be having certain problems, so that is triggering your problem. Okay, the problem in a wife is having the problem in you. Suppose your physical illness is also causing your mental problem. Okay, we don't know exactly. When you take a pen and paper, sit and work, understand everything, write it down, make it prioritize, then understand which one is giving you more trouble, which one is giving you more trouble. That perpetuating problem means the factor which is not letting your problem to come down, the factor which is not letting your problem to come down, suppose, which is just maintaining your problem. Okay, nowhere it is coming down. You take an example, I'll tell you. You are a diabetic patient. Okay, you're staying away from your family. You're staying away from your family. You're about 45 years old and a diabetic. You know that you have to take insulin daily. You have to maintain the diet properly. You have to eat the proper food and all. You should limit the salt and sugar intake, everything. But your diabetes is not under the control. The diabetes is fluctuating. Sometimes it goes very high. The number shoots up very high because we don't know why it is in the. You need to understand what is the problem which is maintaining. What is the factor which is maintaining your diabetes? Yes, you are away from your home. That is one. Second, yes, you are not maintaining because nobody is there to cook. Okay. Yes, another factor, the job. Yes, morning you'll go at 8 o'clock, evening you'll come at 8 o'clock. You're almost tired. Okay, you cannot cook by yourself. You just get whatever that is there and you will eat and sleep. This is what something which is maintaining your problem, and you have no time to physical activity. Yeah, this is what something you're maintaining your problem. Okay, like that, you apply this to everyone. You apply this to any kind of illness, then you will understand that what is predisposing, what is precipitating, what is the problem which is maintaining. Okay, this is what you can apply it if there is a fight between the husband and wife. Okay, there will be a fight. So every day we sit and we talk and we resolve the issue, and the next day there will be again fight. Why it is like that? And what is the factor which is maintaining? Whether it is apart from the husband side, whether it is apart from the wife side, or somebody else is interfering between you, or that interference is causing the fight between you, or which is maintaining the fight, which is not letting down your fight to come down. You must understand this is what perpetuating factor. The factor 4 is called protective factor. This is very important. Every problem there will be something to protect you. Every problem there will be something to protect you. Those protective factors we need to identify. Okay, protective factors are nothing but supportive factor which will support you. You have a problem, yes, your friend, he will support you. Yes, you have a daughter or mother, they will support you. Or somebody, some other factors, they will support you, or your mental capacity or your strength, that will support you. We need to find out this supportive factor. I have given a diabetic patient example there. Yes, you are away from your family, but there is one of your friend who is very close to you. He can give you food, home food. Okay, home food. So he is a protective factor for you. Okay, so because of increasing a protective factor, minimizing a perpetuating factor will always keep your health better. Will always keep your health better. This is what the model you can apply everywhere. It will give you a very good understanding how to understand the concept, how to understand the factors which are playing around the illness, which are playing around the illness. As I mentioned, it's a 4P model. Predisposing, take a pen and paper, write it down. Predisposing factor, precipitating factor, perpetuating factor, protective factor. This is what you can apply it in anywhere. I have told substances also you can apply. Next, this is what the cognitive model. Cognitive model, this will help in terms of understanding your own cognitive process. Your own cognitive process. Somebody asked me how to manage the anxiety, how to manage certain situation. Even I have sent a Google document yesterday, and in there was one question where I will behave excessively, I will react excessively in certain situation. Okay, there I have understood that most of the people responded, yes, I responded and agreed that I responded excessively to certain situation where that excessive reaction was not actually required. Okay, so this is because of many other factors that we need to understand the cognitive model. So where these you are seeing on the screen: thoughts, physiological sensation, feelings, and behavior. Take one situation I have told. A situation, it looks very simple to some people, the same situation looks very big to other people. If you are in a particular situation, what is the thought that comes in your brain? Okay, this is what you can keep a thought diary. Okay, you can keep a thought diary, you can write it down. What is the situation, what thoughts it triggers, and following that thought, what is the feeling that you have? Okay, yes, I have a thought, the feeling is so happy, the feeling is so happy. Then understand your physiological sensation. When the person is so happy, his physical activities will be more active, and he will be more active in terms of his physical activity, in terms of walking, in terms of talking. Everything will be little little more, little more. And what is the behavior that we need to understand? What is the behavior? This is what you just think. Yes, you're going to talk to your boss, then thought, then the feelings, then the physiological sensation, then the behavior. If the if the thought is good, the feeling will be good, physiological sensation will be good, then the behavior. If the thought is bad, threatening, if the thought is threatening or frightening, the feeling is that anxiety. If the anxiety is that, the physiological sensation, palpitation, heartbeat will be faster, breathing difficulties, sweating, trembling. Okay, then the behavior is that you cannot do anything, you cannot concentrate on anything, you cannot talk to anybody. Okay, you cannot do your work properly. Sometimes you may get angry also, you may rage at somebody. This is what thoughts, feelings, physiological sensation. You need to have an awareness on this. Okay, if you have an awareness, this is what we call it as a mindfulness based therapy. Mindfulness based therapy, see, this will help you in terms of understanding your own cognitive process. In the mindfulness based therapy, you just sit at one place with a calm music if required. There should not be any kind of a disturbances. Sit at one place. Okay, close your eyes, take a deep breath and just relax. Take a deep breath and just relax. Close your eyes. You just focus completely on your breathing. Inhale and exhale. Okay, see how many thoughts will come. You need to just observe. That's your duty is to just observe thoughts. Thoughts will rush. Thoughts will rush. It cannot be complete silence. Thoughts will rush. Many thoughts, many situations, many thoughts will come. Okay, how the thought will disturb you while you are just relaxing? It will not just relax. It will not let you relax at all. Okay, but like that, the many thoughts will come and go. The nature of the thoughts is like that. Thought will come and go. Thought will come and go. Thought will come and go. But you must be able to capture only thoughts that require. You must be able to capture only thoughts that require. This is very much essential. If you practice it, then you will get that ability. Okay, if you that is what, like even the yoga and meditation and all, they do that only. They'll play calm music and sit and just observe yourself. The thoughts will come and go. Thoughts will come and go. Thoughts will come and go. Don't give attention to the thoughts, and the concentration will automatically come. Okay, don't give attention to the thoughts. Thoughts will come and go. Let it come and go. Let it come and go. And don't give attention to the thoughts. Automatically your concentration will increase. This is what we say, the yoga, the chemical changes that happens in the brain. So it will increase your concentration, because you will gain the ability to let the thoughts go, because you're not paying any attention to the thoughts. Okay, this is what we call primary emotions and secondary emotions. If you gain the ability over this, you will understand your cognitive process very well. Next, management of a common mental health disorder. And so many people ask me this question. Number one is a pharmacological therapy. Yes, certain illness, if it reaches peak, if you are unable to manage it, then if you're unable to manage it, yes, then the pharmacological therapy is very much necessary. You need to go. You need to consult the doctor. You can talk to them, and they will advise you, or they prescribe you certain medications. The medications will help you to overcome that. This is one. Second, you cannot be on a prolonged medicines. Okay, yes, for a very certain amount of period they may prescribe a medicines, but you must practice non-pharmacological medications, especially the lifestyle modification. That is very much important. Okay, lifestyle modifications, it is varies from person to person. Okay, you need to develop a routine physical exercise. I have told you that the physical activities are very much important. Anything, it may be the running, it may be the playing cricket or playing shuttle or playing badminton, etc., etc. So these physical activities, it will keep you mentally strong. At the same time, it will increase your physical strength. It will increase your physical strength. Any kind of a stresses, you can bear it easily. Okay, so you will gain that ability to address and to manage it. And the healthy diet, and somebody asked me that, during a depression, like what kind of a diet that we must maintain. But healthy diet is very much important, and limit the non-veg, I say, and the salt and sugar intake. This is very much important. Like up to one age, it is okay, but one age, after you cross one age, you should limit your non-veg and salt and sugar intake, because it causes other lifestyle disorders, like the cardiovascular problems and diabetes, hypertension, etc. At the same time, healthy diet is very much important, and add more vegetarian food, add more greens, add more vegetables, add more fruits in your diet. This is very much important, and nuts and dry fruits in your diet. That is very much important. Okay, and it will easy for the digestion, and it will keep you more healthy, and it will decrease the cholesterol level in your body. It will decrease the cholesterol level in your. It will keep you more active. Throughout the days and activities. About the tobacco and alcohol, is very much important, because see, when I talk about the management, you just understand. You go to any doctor to diagnose the illness. The process is lengthy. To diagnose the illness, the process is lengthy. When it comes to the management, the process is very simple. They give just one or two pills, ask them to take these medicines for a period of time, will be a normal. Diagnosis take a time. This is what, see, management of any kind of a illness. Yes, once you understood this is what the illness, the management is a routine. This is what you need to do directly. But understanding the illness take, this is what, in the 3 hours of session, 2.5 hours I spoke about the illnesses, and only half an hour I'm going to talk about the management of illness. Because management, once you understand about the illness, the management becomes easy. If you don't understand the illness, the management becomes difficult. Okay, then the health, avoid the tobacco and alcohol use. Keep it in mind, they are not the stress relievers. Tobacco, alcohol are not the stress reliever. They are the most causes stress or any other psychological problems. See, tobacco, we may say that tobacco products, I have told, which contain a substance called nicotine, which is addictive substance, number one. Second, I'll give you one example: cigarette, which contain nearly, or any other tobacco product, which contain nearly 4,000 chemicals, in which 36 are known carcinogenic. 36 are known carcinogenic. 4,000 chemicals. Let me explain you certain chemicals you might have used in your labs also. Tar and butane and paint and certain acidic components, and these kind of substances they use in a cigarettes. These kind of chemicals they use in a cigarette. Okay, if you take one cigarette, so which contains 36 carcinogenic. Carcinogenic means the agent which causes cancer. Carcinogenic means the agent which causes cancer. So alcohol use also I have told, and tobacco. Tobacco, we may say that tobacco use, I have seen people that are using 30 years, 40 years, nothing has happened. No, tobacco is the one which will hit each and every part of your body. If you consume alcohol, the main organ which damage is that the, what is that, the liver. But if you take alcohol, each and every part from the top to bottom, each and every part of your body, the tobacco will hit. So this is the level the tobacco damages to your body. And alcohol use also, but they're not the stress reliever. They increases the stress, and at the same time they makes you more vulnerable towards mental disorders, and even physical also. They spend quality time with the family. This is more important. See, family is the sources of stress. At the same time, it's the sources of solution. We must understand the family is the most important. We must give a quality time to family. Okay, I tell you, wherever you be in the world, once your life is ended, and you will be brought back to your family. That's the capacity. That's the beauty of your family. Wherever you be in the world, once your life is ended, you'll be brought back to your family. Send and spend. This is what the family is very much important. Spend a quality time with your family. Give a time to your family. Give a time to your children. Spend time with them. Talk to them. Go out. Give time. See, there will be a lot of sources of stress. I tell you, the family is also source. At the same time, the family is also source of solution. Okay, yes, the work is important. If you give too much importance to the work, then you are giving a less importance to your family. Then the family will dissatisfy out of it, and the family will starts giving you trouble. Then you cannot achieve what you wanted to achieve here. It is important to balance. I hope that work life balance session might have taken, they have addressed it. And the deep breathing and relaxation exercise, I'll tell you one. There is a particular method called Jacobson muscles relaxation techniques. Jacobson muscles relaxation techniques. People who cannot go out, who cannot do physical exercises, or who cannot play outdoor games and all, they can practice at home only. Deep breathing and relaxation exercises. Deep breathing are very much important because deep breathing, especially during a stress or during anxiety, withdrawal symptoms, your breathing will be shortened. Okay, sometimes you cannot take the required amount of oxygen, so that the deep breathing will also help you. It will kind of balance your breathing system. Deep breathing and relaxation exercise, Jacobson. I will repeat again, Jacobson muscles relaxation exercise. And sufficient sleep, minimum 8 hours, especially currently because of this pandemic, many people have developed the sleeping problem. In general, in the language of psychiatry, we call it as insomnia. Insomnia is another condition where a person is enabled to inability to fall asleep. Okay, there are three levels. Number one is adjustmental insomnia, and so adjustmental insomnia when the places changes, when certain situation during an exam or during any, especially marriage, time and all, especially if at family, some members will not sleep. Okay, they'll always think of work, 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 that is pending, this is pending, etc. This is what the adjustmental insomnia. And this is only for certain time. The second is that the chronic insomnia. Chronic insomnia because of a physical illness, because of a mental illness, because of certain medication. Because of certain medication, a person will develop this kind of a chronic insomnia. Especially as the side effects of medicine, many people will not get a proper sleep. But I tell you, the sleep is very much important. Sleep is very much important. But here we say that minimum 8 hours of sleep is important. But at the same time, when you come to the insomnia, as I have told, there will be three levels of sleep. Number one is three levels of difficulties. Generally, people will face that initiation of sleep, maintenance of sleep, and consolidation of sleep. Initiation of sleep, people will get difficulty in terms of initiating a sleep. They go to the bed, they just roll on the bed. Sometimes it goes up to 2 o'clock, still they'll not get sleep. Second, maintenance, they sleep, and in the middle of the sleep, they'll get up and they'll not get sleep. And consolidation, ending sleep, and they'll get early in the morning, 3 o'clock, 4 o'clock, they'll get up and they'll wake up and they'll not get to sleep. Okay, so this is the problem that they have. Better it is better to develop. It is better to have a sleep cycle, and the particular sleep period, 11 o'clock to morning 7 o'clock, or 10 o'clock to morning 6 o'clock, or 10 o'clock to morning 5 o'clock. You must have it. Okay, especially when you have a sleep difficulties, you need to practice a technique called sleep hygiene mechanism or sleep hygiene techniques, where I'll just tell you a few techniques. You can practice it, you'll get a better sleep. Number one, after 4 or 5 o'clock, please avoid drinking coffee or tea because it will stimulate your brain. Coffee or tea, number one. Second, if you have a habit of consumption of alcohol or tobacco and all, please stop it. It will again disturb your sleep. And then especially the room in which you sleep, makes it more light color. At the same time, there will be a dim light. Use that room only for the sleep, and don't do any other activities such as sitting on a bed and calculating something, sitting on a bed and writing notes, sitting on a bed and doing something on the laptop, sitting on a bed and doing something, some office work related and all. Please don't do that, because when you go to the room where you sleep, the sleep only has to come. If you do other activities, the lot of other thoughts will come, it will disturb you. And then don't listen too much loud music before you sleep, too much, a kind of a funny or very attractive videos before you sleep, because it will disturb. When you see that kind of videos, or when you see that kind of music, it may disturb, or it will keep your brain more active, the sleep will not come. And read some books. If you don't get sleep, better you read some boring books. Okay, boring books in the sense, like if you read 1 or 2 pages, you need to get bored. That kind of books, you need to read that kind of books. That is more important. And okay, fine. During don't eat more in the sense, like if you eat more acidic content food, it will disturb your sleep. Too much of masala, too much of spices. Okay, too much of masala, too much of spices will make you drink more water. If you drink more water, like for a urination, you need to get up more. Okay, especially during the night, you need to eat very soft nature food, and please avoid eating more spicy or more masala foods. And avoid naps. If the afternoon sleeps, if you have the habit of sleeping in the afternoon, kindly avoid it. Okay, So if you sleep afternoon, it may disturb your night sleep. And do certain physical activity. If your body is tired, so it needs a rest. It needs a rest. That is what. If you play some outdoor, if you wanted to play, just play some outdoor games and all. Okay, games are very much important. If you just go to the gym, or if you just walk and all, your concentration only on walking, or your concentration will be only on doing some gym work, lifting weights and treadmill. If you just involve into some playing games and cricket or shuttle or any other kind of a games, like the more of the mind aspects will involve, like you need to judge where the ball comes, where the shuttle comes. You need to judge like where I need to move my body, where I need to go, and where I need to move my need to bend. Like playing games and all, it's a work for the entire your body. Okay, but at the gym or other activities only give a work to certain organs. But playing games and all, it's a physiological as well as psychological exercise. Take a break from the technical yoga and meditation. I've told this is very much important. Take a break from the technical gadgets. This is very much important. Don't don't use more take a break from the technical, especially using a mobile phones and technical gadgets and the social medias, especially during the sleep. See nowadays, like what people will go to the bed at 10 o'clock, they will sleep at 2 o'clock. What they do, they play games, they see social medias. So they see what Facebook, they see Twitter, they see Instagram, etc., etc. I tell you one thing, you just make a practice or make a exercise now only. Take a mobile, open the Facebook, see it. Open the Facebook to see it. For every 10 to 20 seconds, there will be new feedings. There will be new feedings. If you just scroll it down, you will get a new feedings. Anything which comes new, the brain will be more active. Anything which is new, the brain receives it. Anything which is new, the brain receives it. Like that, you will get a new feedings frequently, so that the brain will not become calm. It will be more active. It receives more information, so that your sleep's time will get prolonged. So this is what a damage. Then the build a skills such as time management, problem solving, conflict resolution, negotiation, and communication. See, the communication is very much important. So there is a proverb in Kannada, ಮಾತು ಬಲ್ಲವನಿಗೆ ಜಗಳವಿಲ್ಲ, ಊಟ ಬಲ್ಲವನಿಗೆ ರೋಗವಿಲ್ಲ ಅಂತ. Person who knows how to talk and he will not have clashes with the people. A person, he knows how to eat and he will not have any kind of a health problem. So this is what that meaning. Communication is very much important, because of this communication, a lot of clashes happens at office level and office lot of clashes happens at office level and family. I just wanted to tell one incident, which was very nice incident I had. I was in a family therapy. I was doing a family therapy where was referred a couple. The couple was both of them aged 60 plus, almost 60 plus. Husband was epileptic. Husband was epileptic patient, and they were actually good couples from the last 10 years. From the last 10 years, there was a severe amount of clashes between them. Husband used to get aggressive and used to scold, abuse verbally, physically, wife like anything. And both were good. And over a period of time, what wife has done that whatever husband says used to be just silent. Wife used to be just silent. She never used to reply anything. She never used to talk anything to him. And finally, what happened? Wife stopped talking to husband, because wife cannot tolerate the way he behaves, his aggressiveness, his abusives and all. She cannot tolerate it, and finally she stopped. And once they came to the epilepsy to take for the follow up, and the case was referred to the family therapy, and the case came to me and one of my friend colleague, and we both were saying, and we listened lot. And before they came to me, and they were undergone around 15 sessions of family therapy, and they were not seeing any kind of improvements. And they came to me, and I asked them. They were speaking Kannada, very good Kannada. I asked them like, what has happened, everything. And wife asked me, "You look like my son. I hope that you're not married also. Then how do you solve our problem? You don't know anything about the marriage. You don't know anything about the kind of relationship that happens between wife and husband. Then how do you solve our problem? We have come here and we have taken almost 15 sessions. We have not seen any kind of improvements. What are you going to do now?" She asked me. Then I understood the kind of frustrations, everything. Then I've told, yes, yes, uh, whether I'm married or not doesn't matter here. At the same time, I understand your problem, and yes, I'm trained here. I'm skillful. I understand all family dynamics and family therapy techniques. I will help you to solve your problems. Then, then we understood what is the problem. The problem is only that they fight. One day we understand, second day we understand. All the therapists they told don't fight, don't fight, don't fight, use all these techniques. And we use the different techniques. We told them fight, don't stop fighting. This is what the technique we told them. Fight, don't stop fighting, but you both should fight as we told them. Then we gave them what to do while fighting. Okay, we gave them certain techniques in a way. You should fight in a week two times. You should fight Wednesday and Saturday. This is the only time we gave a schedule. 5 to 6 o'clock, 6 o'clock in the evening you should fight. Wednesday 6 o'clock, 7 o'clock, sorry, 5 o'clock to 6 o'clock you should fight. And Saturday 5 o'clock to 6 o'clock you should fight. Before that, what we need to do? They said, before that, Monday, what happens? You should not fight. Make a list of all things that makes you more angry, that makes that you wanted to fight with her or fight with him. Husband and wife, they have to do both. Monday they have listed, Tuesday they have listed, Wednesday till afternoon they have listed, Wednesday evening came, they need to start a fight now. When the time came, they didn't fight. The same happened 2 weeks. After 2 weeks, they came for the follow up. Then we said, did you fight? They said, no. Why? We told you to fight. They said, no, we can't fight. Why? 10 years you fought like anything. Now why you are not fighting? You should fight. You should fight as we told. Then we asked you, why didn't you fight? They laughed. They laughed and said, sir, we made a list. After seeing the list, we felt so silly, sir. Why? These are our very silly reasons why we are fighting for these reasons. Okay. That is the time they stopped fighting. That is the time they stop fighting. This is what we call it as a fair fighting. This is what the communication, because they were talking each other. I told wife stop it. No, they were talking each other. They were talking. The fight was a mode of communication. Through the fight only, they were talking each other. They were exchanging the information through the fights only. Okay, so this is what, when the communication is proper, so then we can resolve many things. So then we told, yes, issues are there. I don't say that issues are not there. Issues will be there. Okay. We must be a little sensible to understand the issue. Okay. We should not always be one side. We should think from other side also. Okay. We should think, yes, husband should think from the wife side. Wife also should think, stand in the place of husband and think. Okay. So then there will be compromises. Then there will be understandings. Yes, these kind of a fights also will be there. If the fight does not, if continues, then come to an agreement. Okay, we'll fight on this particular day. Make a list of all these things. Then discuss, prioritize. Then you will understand what is important, what is not important. So that is what I told in the last thing. Be positive thinker. Yes, there will be a lot of negativities. At the same time, be positive. Be positive thinker. This is what that helps to manage most of the things. This is for the stages of motivation. This is for the substance use. This is for the substance use. Especially a person who uses alcohol or who uses tobacco or any other drugs, we need to understand these 5 stages: pre-contemplation stages, completion, determination, action, maintenance, and relapse. Pre-contemplation stages, like for this drug behavior, you will not have a thinking that I need to stop it. Person will not be having a thinking of stopping a drug use. This is pre-contemplation. Contemplation, you will start thinking, yes, for my problem, drug use is one reason. Yes, I need to stop. Then the determination, decision is made to take action or change. Then the action, then the treatment, maintenance period of abstinence. Once the action is started, then you will maintain. Then you will maintain the abstinence period. Then the relapse. Yes, relapse is a common in drug, prevention. Relapse is common. If a person is quit today, anytime he may get relapse. Relapse means going back to the same pattern of drug use. Next, management, especially this is for the substance users. This is the first management technique, 4Ds. If you have a substance use problem, delay. Suppose delay, make more delay, then the craving will come down. Okay, distract. Suppose this is the time I will go for the tobacco smoke or smoking or consumption of alcohols, whatever. Distract. If it's 6 o'clock, and be with your child, be with your family, go to the temple, go to something else, involve in some work. Okay, then you will distract yourself. Deep breathing and drinking water. Deep breathe, like whenever you feel more craving, take a deep breath and drink water. Drinking water is very much important, because why I'm telling, during this anxiety, during this anxiety or stress, there will be dry mouth. To avoid the dry mouth, drinking water is one important. Second is, don't pee in an empty stomach. Okay, empty stomach leads to more craving. Eat something or drink water. When your stomach is filled with something, then the craving level will come down. For a tobacco users, use this star method. Set a date. Yes, I'm using a tobacco. Set a date. Yes, I wanted to stop it now. Date. Probably it's a birthday of you, birthday of wife, birthday of son, or a festival day, or a New Year day, whatever. Take a date. This is the date I'm going to stop it. Once you have taken a decision, talk to your family and friends who are very close to you. Talk to them about your decision. Yes, I'm going to stop it. Please help me. Please support me. Anticipate challenges. I have told you that once you stop it, you will develop a lot of physiological, psychological withdrawals. And what is that? How to address that? Removal of all tobacco products from your surroundings. Remove everything and throw it off. This is one. Relapse prevention. We must understand that, remember positives or negatives of a drug use. If you use drug, what you get out of it. If you don't use, what you get out of it. Make a comparison. High risk situation. Suppose when you meet friends, you will go for substance use. When you cross the road, or when you go near the wine shop, you will, that is a high risk situation. Or any other, probably the work stress, any kind of high risk situation. This is the high risk situation that you need to understand. So avoid going near the shop, avoid meeting of friends, avoid particularly engage yourself in particular time. Okay, so which will induce or which will trigger the substance. Thoughts and actions. Okay, when you get that substance use mood, when you get that thought, yes, I wanted to drink, I wanted to smoke, and what is the thought and what is the action? Suppose if you had earlier tried to hit, and you just think that, what you have stopped it and you have restarted, and what happened then? Okay, make a comparison. Monthly budget plan. Okay, how much you have saved, how much you are redirecting that amount to what? And then the communication I have told, and most of the communication I've told, like with the family members, or with the neighbors, or with the friends, or at the office, your communication, certain communication triggers substance use. Okay, and the daily activity schedule. So there is a saying in English called, idle mind is a devil's workshop. Okay, the empty mind gives you more unwanted thought. Better you be active in certain work. When you're more active, then your brain also will be into that, and it will not have a time to think other aspects. Drink refusal scenario. Role play means certain. Okay, you need to have certain role play. So when person will ask you, when the close friend, he will say that come, we'll go and drink it, then how to refuse it, how to say no. Be assertive. This is very much important, because friends may say different things. See, I'm your close friend, can't you drink for me, like that? Okay, so these are all emotional trap. Don't be. And reward yourself when you stop it. Give something to yourself, prize yourself, give something to yourself, reward. So that reward makes you more happy. At the same time, the happiest things wanted to continue more and more, so that there are possibilities you may be out of substance. Thank you so much. My presentation is over. Any doubts you can ask. Any doubts you can ask.
Uh, yes, thank you, sir. Thank you very much
Yeah,
for
yeah,
your
yeah.
informative session. Dear participants, if you have any queries, means you can post it in the chat box. So we got a positive feedback, sir. Interesting session, great session, very informative and wonderful session. Thank you, sir.
Thank
Very
you. Thank you so
informative
much.
session, interesting and useful session, sir.
Okay, thank you so much. Thank you so much for the feedback. Any questions thrown?
Sir, there is one question.
Yeah.
When a child gets affected due addicted parent, what is the remedy?
So please, once again the question.
When a child get affected due addicted parent, what is the remedy?
Addicted parent means, I didn't understand exactly the question. Child affected or what?
Child gets affected due addicted parent they have given, sir.
Okay. If the child, okay. If the child is affected by the parents' addiction.
Sir.
Okay. If the
Yes, sir.
child, okay, fine. Yes, there are chances even the child will adversely affect by the parents' consume, sorry, addiction. we need to see the severity of affection, what kind of effect that is made on the child, whether it is the emotional level or any other kind of things. We need to understand it. Okay, if you feel that yes, your child is affected largely, the child daily routine is going affected very largely, better I say better you consult any child psychiatrist. That is more important, because if the parents addiction not subsided, if the parents addiction not decreased, the child problems will not decrease. Interdependent. Okay, interdependent. We cannot say that only the parents will continue their substance use, their addiction, but child should be all right. This is highly impossible. The changes required both side. Changes required both side. Okay, I think I would prefer family therapy for this. If I completely understand the family background and family dynamics, I can give you the better solution. Okay, there will be a large impact on the child by the parents addiction. Okay, but the proper investigation is required for this. Okay, if they are
Yes.
nearby, they can come to family therapy. If there are any other state, I can give the reference. Yeah,
Okay, thank you, sir. There is one more question, sir.
yeah.
How to prevent being low, especially when we are being accused when we have done nothing wrong?
Okay, so
How
come
to
again, please,
prevent
one more
being
time.
low? Yes, sir.
How to prevent?
How to prevent being low, especially when we have been accused when we have done nothing wrong?
Yeah, so sometimes this is a dynamic that happens, whether it is intentionally or non-intentionally. We must understand that. So this is number one. And second, yes, if you are not trying, it is better to be assertive. Okay, why I am telling you better to be assertive, that yes, if you accept yes, you have not done anything wrong, if you're just being uh, you know uh, simple or just being silent, it will affect you, affect your mental health. Okay, you be assertive, convey the clear message to the to other person. Okay, other person, saying that be clear in your message. Say that if it is continue, it is affecting me like this. Okay, when you have not done nothing wrong, but still you are being accused, say that yes, I have not done wrong. Be assertive, say no. You say you cannot accept it. If I accept it, this is going to be cause my mental problem. I don't want to have it. So you must understand this. When a person is being more assertive, so I think his mental health also will be good. Okay, I would prefer you develop assertive skills. Okay, say no skills, say no skills.
Okay, thank you, sir.
Yeah.
There is one more question, sir.
Yeah.
Can the addiction reduce by communication with himself?
Yeah, I think yeah. You need to. I have told 4P models. Okay, I've explained the 4P models. You take a pen and paper, apply it on yourself, and talk to yourself. Of course, you're a beautiful self. Okay, you're a beautiful self. No, there's no doubt about it. Talk to yourself and apply it on. You just think like predisposing, precipitating, perpetuating, and make a point everything. Then you understand what is causing more addiction, why it is getting more addiction, why it is maintaining, why I am not coming out of it, what is the cause for that. Then you will understand the situation, then you can work on it. Okay, if you need a help, like you can take help, especially yeah, I just wanted to tell you, for the tobacco users, there is a quick line, there is a quick line helpline. Okay, I will just tell you the number: 1800 1800 11 2356 1800 11 2356. This is a central government initiated tobacco quitline number. You can call this number, you can get a free counseling services. Okay, nobody knows about your information. They will give you a free counseling services to help you to quit tobacco only. For others, I have told you the 4P models, and you can talk to yourself, communicate yourself, take a sleep and make a practice. I've told make a situations where that triggers you, substance. By understanding that, you can overcome with the help of therapist also. Yeah. Next.
Thank you, sir. There is one more question from Usha, sir.
Yeah.
When we leave the ego and superego in our life, everything will be fine. What do you say, sir?
Okay. The madam is talking about the ego and superego. Yeah, madam, I just wanted to add one more thing. But I have little confusion with regard to the ego and superego, because what I have read, this is the theory by a famous person by name Sigmund Freud, you might have heard. Sigmund Freud, who has given this concept id, ego, superego. Id means uh, it is a structure of personality. Uh, it wants more pleasure. It wants more pleasure. It wants satisfaction. It doesn't want any kind of a pain. That is what we call it as a id. It works based on the pleasure principles only. Generally, we see it among children. That is why I'm just saying example among a small baby. You just take a 6 months old baby. When the baby cries, what baby wants only milk. If the mother is fed, automatically baby stop. But the baby doesn't understand why mother is not giving me milk, what work she is involved in, why she is not coming. Okay, baby doesn't know. This is what it is always wants a pleasure. Ego works based on the reality and what is real, what a person observes, what a person sees, what a person experiences. Based on that, ego will work. But I would say when the ego is very strong, I think the see sometimes ego also be compared with arrogant. Arrogant. I have an objection with that, but ego is totally a different concept. Okay, ego is always totally a different concept. But your thoughts and your action must be based on the reality. That is always better. That is always better. That is always objective in terms of subjective. It is better to be objective. Okay. And third one, superego. Superego works based on the morality principles, the practices, the religious background, the culture, the traditions, and the customs that you practice. Based on this, the superego develops. Superego develops. See, the superego will contain a concept called ego idol, or will contain a concept called ego idol or conscience. Conscience means manasakshi. Conscience manasakshi means it knows what is right and what is wrong. Okay, what is right and what is wrong. Madam, you said about ego and superego, but there will be a lot of clashes between the hidden superego than the ego. Okay, ego is always works as a judge. Egos works as a judge. Ego will always come in between the clashes between the superego and hate. It will take a decisions what to do, what not to do. So I will always prefer your ego should be strong. At the same time, based on the reality, based on the experience, based on the objectivity, it is always good. So we can maintain a better relationship. When you're subjective, more prejudice will be there. Like if somebody says something, we believe that it is as a final. Okay. So this is what the concept, the theory actually says in a different way. But if you leave completely ego and superego, no. Okay. But based on the reality, whatever that you wanted to do, make it based on the reality, based on the objectivity. So that is good. Yeah.
Thank you, sir. Here is the last question, sir.
Yeah. Yeah.
Teenagers are very vulnerable to addictions. So, what
Yeah.
is your opinion on how to guide them?
Yeah, it is very important. The teenagers are very vulnerable to the addiction. The age itself is like that, like more of a floating sort of a thing, more of instability. uh, they are in the process of learning things. They are in the process of what to do, what not to do, in which they'll be more curious. They wanted to make more experiments, and they will influence easily by other people. They will influence easily by other people. But I would say when the teenagers, they parents need to see that they must have a very good bonding, very good relationship, very good understanding with the teenagers. Okay, if they have a very good understanding relationship with the teenager can express everything with the parents. The parents should be the first people. Okay, they can express, they can share everything with the parents. The parents can guide them towards what is right, what is not right. Okay, if there is a distance from the teenagers and parents, and the teenagers will always incline towards a people who are more influencing them, and incline towards the people who will respond to them, incline towards the people who will respond to their emotions and etc. Okay, the parenting is an art. I have told here, you must be authoritative parenting, not authoritarian. It's authoritative parenting means you where it's a healthy parenting. You know where you should liberate your child. You know where you have to set your limits, set a limits to the child. Okay, the child can share, the teenager can share everything with you. At the same time, you can guide the teenager to the better route. What is good, what is not good. There will be a lot of questions in the teenager's mind. You can answer all those questions. You can give a clarifications to all those questions. Okay, so this is where the relationship matters more. The parents must have a very good understanding relationship bonding with the teenagers. So you should be the first person where the teenager can share everything, and the other should be the second people. Okay, this is how it helps.
Yes. Thank you, sir, for
Thank
your
you so much.
valuable Thank you, sir. Thank you, sir.
Thank you.
So we
Thank you
would
so
like to
much.
thank once again Mr. Pradeep sir for
Thank you
accepting
so
our
much.
invitation and gracing the resource person for session 4 and session 5.
Yeah.
From the entire SPC fraternity, we once again would like to thank
Thank you so much.
very much, sir.
Thank you so much. I
Yes.
thank the whole team, SVCE, especially of the Department of Electronic and Communications, Shivasankar sir, and for having invited me for this program. And it was actually wonderful. This is, if it is live and if it is a physical, probably it would have been more a discussion and interactive sort of a thing. I look forward,
Yes, yes.
if in future, if time permits, if everything goes well, uh, we can have a live interactive session also in future. Thank you very much for everyone for your patience listening, and your feedbacks also. I really honored and pleased by your feedbacks. I thank whole team SVCE, especially head of the department, Electronic and Communication Department, for this opportunity. Thank you so much.
Thank you, sir. Thank you. And
And I
we
request,
would like, yes,
yeah, and I request, actually, I have sent a Google form yesterday, and I have actually disabled the religion. Just I wanted to understand
huh,
what content I can cover in the session. For that reason, I have sent the questionnaire. Okay,
huh,
so
sir.
that is one reason. Especially somebody asked me about the religious part and all. I have disabled it. If you want it, you can mark it. If you don't want, you can no need to mark it. I request everyone to fill it and send so that I can understand what kind of content I can cover in the future sessions also. Thank you so much. Thank you so much. Yes, sir. You are saying something.
Yes, thank you, sir. Thank you. And
Yeah.
we would like to thank all the participants for your active responses. And we request all the participants kindly join for the session number 6 in the afternoon at 2 o'clock.
Thank you
Thank you,
so much.
everyone. Thank you, sir.
Yeah. Thank you so much.